Good afternoon. It was almost a month ago, March 11th, that the WHO declared a pandemic. And when we think about what has happened in that period of time, the number of cases has grown so much. Last week, globally, over 1 million cases they surpassed, and worldwide, over 65,000 deaths. As of yesterday or this morning, across Canada, there have been over 15,500 cases of COVID-19 and 280 deaths. The cases in Canada are doubling every 3 to 5 days. Again today in Prince Edward Island, there are no new cases of COVID-19. Our total remains at 22. 8 of our cases are now considered recovered, and our other cases are at home. In terms of our testing, we've done over 1,300 tests here in Prince Edward Island, and almost 1,000 of those are negative. We do have a number of tests pending from over the weekend, which are being sent to the National Microbiology Lab, and we anxiously, including me, await those results. Our testing ability locally did close to 50 tests over the weekend, and they were performed particularly on high-risk individuals, healthcare workers, those who admitted to hospital or community care facilities. We anticipate tomorrow having increased test kits available for the QEH to perform locally, and by Thursday, tests will be also able to be performed at the Prince County Hospital in Summerside. I know we don't have any new cases to report again today, but it is not a signal to stop or slow down our public health measures, and the worst of this is not over. And certainly what I'm learning more about as we start to look at what is happening across the country, and I believe what we are doing is making a difference. But very importantly, and I implore everyone to listen to this, we must continue to physically distance, self-isolate when required on return from out of province, and really to follow these recommendations and these public health measures. If we ease up now, we will not have the impact we need to protect islanders and our system. The better we all do now may mean we can ease up in a way that we all want, and we may be able to ease up earlier. But if we do not follow these public health recommendations very well, we will have to spend a longer time doing them. Certainly lots of discussion about masks. We know the most effective ways to protect yourself and others from COVID-19 are to stay home as much as possible, practice physical distancing, washing our hands often, cough into a tissue or sleeve to reduce the droplet spread. And masks are important in protecting healthcare providers who work in close contact with patients with respiratory symptoms in particular. And wearing a homemade cloth mask in the community has not been proven to protect the person who is wearing it. But there may be circumstances where wearing a mask in public places where it is difficult to maintain physical distancing may help protect other people and workers around you if you're in the early stages of illness before symptoms start. A mask in this case is similar to coughing into your sleeve. And these circumstances would be if you're on a public transit, for instance. It's important that we remember wearing a mask is not a replacement for other public health measures. Staying at home, washing hands, avoiding crowds, and practicing physical distancing are your best ways to protect yourself and others. We're getting still lots of questions about essential workers, and if you are returning as an essential worker from out of province, it's very important to self-isolate when not at work. We know there's community spread in our neighboring provinces in New Brunswick and Nova Scotia, for instance. It is really important that people returning from interprovincial travel, whether they're essential workers or not, remember the importance of self-isolation. We also are receiving a lot of calls from people wondering if they're able to go out for walks. And we've also received a number of complaints about those who are out for a walk but who appear not to be physical distancing. So if you are not self-isolating, it is fine to go out for a walk with members of your household. So when you do go outside for a walk with members of your household, make sure you are practicing physical distancing if you come across others. And if you're going for a drive, try to minimize the number of people in the car. And I know we've said it before, but try to have one person designated to run errands for the family, and so that we're not increasing the risk of spread of illness. I've been also asked to comment about shop and swap. And there continue to be individuals purchasing and swapping a number of items online, and I would caution against this. But if you need to purchase something that you feel is essential, you should ensure payments are made online and there's no contact at the drop-off. And if not an essential purchase, please delay any of these transactions. I want to thank all the essential workers across the province for their dedication during this very uncertain time. And this includes our healthcare workers and first responders, our grocery store staff, postal services, gas station attendees, restaurant staff that are providing deliveries, and the list goes on and on. Our essential workers are going to work every day to ensure that we all have what we need to get through these very trying days. And the best way we can thank them is to listen and stay home. Last evening, I saw a report about gratitude, and I thought it was very timely because I want to extend my gratitude to our essential workers, but to extend my gratitude to all of you who are trying to do your part in protecting people here in Prince Edward Island. Someone very close to me always talked about the attitude of gratitude, and I believe that this will help us in the days ahead. Thank you.
En français, je vais juste commencer quelques mots en français. Partout au pays, maintenant, il y a plus de 15 000 cas de COVID-19 et presque 300 morts. Il n'y en a pas de nouveaux cas de COVID-19 à l'île du Prince-Édouard. C'est encore 22, mais maintenant, on a 8 personnes qui sont considérées recouvertes. On est en train de continuer de faire les tests. On a fait plus de 1300 tests ici à l'île du Prince-Édouard. Et on a fait à peu près 50 tests ici local à l'hôpital pendant le week-end. On attend avec un peu d'anxiété les tests qui vont retourner du laboratoire national. Mais même si on n'a pas plus de cas, c'est tellement important de continuer de faire toutes les mesures qu'on parle chaque jour, d'avoir la distance physique, de s'auto-isoler et de rester chez vous si c'est possible. Qu'est-ce qu'on fait maintenant? De plus en plus, je pense que les choses qu'on fait font une différence. Mais si on ne continue pas de faire les mêmes sortes de mesures, ça va nous avoir un grand impact dans les jours, les semaines qui suivent. Merci.
Thank you, Dr. Morrison. Our joint response team has focused on the continued support for our assessment clinics and the testing sites. I want to thank the staff and physicians who continue to run these essential services. We've been preparing staff to operationalize our further response in hospitals and other care facilities, and this has been an effort that's involved staff across the province within health, but other partners to the health system as well. So thank you to everyone who's been supporting our efforts. Plans for a virtual care platform to be used by physicians, nurse practitioners, and mental health and addictions professionals will be launched this week. Communication and education to healthcare providers across the system will start within the next few days, and details on how to access these virtual care options will be coming once training is complete. This will allow care providers to offer services over a secure video platform and improve access for patients and clients when reducing the need for in-person visits. There's no doubt that healthcare providers are the most important resource to be able to care for Islanders during our pandemic. We're caring for vulnerable patient populations every day, and it's up to us to keep them and each other safe. All health P.E.I. facilities have begun saving the used N95 masks, as good research is happening locally and nationally on how to reprocess these masks for reuse, following proper sterilization procedures. This will help with our supply concerns as these masks are in high demand. We're looking at further conservation measures to safely reduce our use of supplies while ensuring our staff and physicians have the protective equipment they need. We received a shipment of hand sanitizer from a local producer at the end of last week, and will continue to work with our vendor to receive this product, but there's been great support from all sectors in supporting our care clinics and staff. The cough and fever clinics and our testing sites continue to run 7 days a week, both in Charlottetown and Summerside. And over the weekend, there were almost 150 patients seen in Charlottetown and 63 in Summerside. Appointments for the cough and fever clinics are through a referral from your family doctor, nurse practitioner, or through 811. And when arriving at the clinics, just a reminder to please remain in your vehicle until you're notified by the staff to come in or to drive through for the testing. The assessment clinics are still providing a telephone option for appointments if necessary. And just a reminder for those of you accessing other essential services when healthcare to please call ahead before your appointment to ensure that it is still scheduled. Thank you.
Open it up. Happy to take questions.
Brittany Spencer, CBC.
Hello.
Hi, yes, my question is for Dr. Morrison. So over the weekend, there was some nice weather and there were lots of people going to parks and trails and things like that to get outside. I'm wondering if you have any concerns about people gathering in parks or on trails, and if you are considering recommending limiting access to some of those places.
Yes, and although I wasn't out at the parks, I understand there were certainly, with the nice weather, more people out. And it's really a fine balance. You want people to be able to, with their household members, get out for a walk. But I understand there were really too many people gathering all together and not really respecting that physical distancing. And so we were having discussions this morning of how we can get that message out better, how we can try to work with parks and authorities to maybe, whether it's limiting access, and I'm not sure we want to do that, but trying to control control the number of people that are gathering in close proximity. When we look at some of the evidence around what a difference it will make if we have smaller number of contacts than bigger number of contacts in this pandemic, it will make a difference. Absolutely, I think it is something we will be following up on, having discussions on, and because I think those things will continue to happen if we're not careful.
Okay, my follow-up question is, have there been any more charges or fines issued for non-compliance when it comes to self-isolation and social distancing?
So as of last night, certainly over 100 different complaints from various sources in through our office and Crime Stoppers and police. They have visited, knocked on at least 71 doors, issued a large number of verbal and written warnings, and there's been a total of 3 charges from the different agencies.
Nicole Williams, BBC.
Hi there. I'd like to just get Ms. Dowling, if you can just expand on these virtual appointments. What exactly will they look like? Who should be, I guess, getting an appointment virtually? If you can just give us some more details on that, that would be great.
Hi, sure. Well, it's really a focus on primary care providers at the moment, as well as some of our mental health service providers, so physicians, nurse practitioners, and the mental health clinicians from psychiatrists and other counselors and staff. So it'll be a video platform for them to interact with clients over that medium. So the details on specific appointments will be very dependent on the individual practitioner, the physician or nurse practitioner or other clinician, and who actually needs that type of a visit versus still being able to offer a telephone visit. So it will be really about having the video option as well as the other telephone options that they have today.
And you mentioned that healthcare providers are getting training and that this would all be available once that training is complete. Can you just let me know or tell us exactly what that training looks like? What's involved in that?
It's really about those providers being educated on how to use the specific tools that they're going to be using with this virtual care platform. So it would be new to many of them, and especially interacting in this way with their clients. So that's really what it's about, is getting them familiar with using the platform and being able to be comfortable using it with their clients or patients.
Steve Stewart, The Guardian.
Good afternoon. First of all, curious to know exactly how many healthcare workers and staff of long-term care homes have been tested for COVID-19.
So I don't have exact numbers in front of me, but we are over the last week collecting information for each of them on the request forms. They are being collected for healthcare workers, and certainly we can happy to get you that information. And I think one day last week, over a period of 3 days, we knew we had 66, but I don't have the test results from the last number of days. Certainly a good portion of those tests that we did locally on the weekend would have been healthcare workers. So happy to provide what we have, but I don't have all the details in front of us.
Okay, I guess as a follow-up question, my second question, I guess this one's more about contact tracing. For people who came in contact with a positive case of the virus, have those people always been tested, even if they never had any symptoms since, say, March 13th?
So all the contacts, of course, are in all the close contacts are put in self-isolation, so they have to self-isolate. So in the middle of March, we were making sure all the close contacts were self-isolating and then testing them if any of them developed symptoms. We have now moved to anyone who is a close contact within even 48 hours prior to a case developing symptoms will then be tested for COVID-19. So that has changed. Of course, lots of guidance changing quickly over the course of this pandemic. But in our circumstances with our cases, our close contacts actually captured that 48 hours prior. So some of them were tested if they developed symptoms, and others stayed in self-isolation for the 14 days without having developed symptoms. But that is our going forward, that will be the case.
Thank you.
Okay, you're welcome.
Dunipi, Guardian.
Hi, good afternoon to you both. I suppose this is a question that could either be for Dr. Morrison or Ms. Dowling. I wanted to ask a little bit about testing. P.E.I, I think, as of the weekend, had one of the lowest rates of testing per 100,000 people in Canada. I think we were second to Ontario as of Saturday. There's been a lot of talk of asymptomatic transmission. CDC is saying somewhere between 10 and 25% asymptomatic people might have COVID-19. What is keeping us from sort of testing more widely? Is it a shortage of kits or anything like that?
Well, hi, Stu. I'll start with answering the question. So there are a couple of things. One, the sensitivity of a test, if you test someone who's asymptomatic, is around just over 60%. And if you test someone who has symptoms, it's up closer to 95%. So I think there's so that's one part of it. And although there's lots of discussion around the asymptomatic transmission, I think, and there's some evidence that those who don't have a lot of symptoms may be able to transmit the virus. It is not the asymptomatic transmission, in terms of its role, is not driving the epidemic at this time, but we are certainly watching that. So partly it's regarding the testing sensitivity, partly it's about what we're learning about what is really driving the epidemic, but wanting to minimize the exposure of asymptomatic or sometimes pre-symptomatic people in transmitting any kind of droplets, whether they're fomites where you touch it and touch your face, or by coughing near someone. So that's the part of the whole rationale around physical distancing. So it's the other part is that we certainly are trying to follow a lot of national guidance around testing. Nova Scotia having moved also this weekend to testing people that do not have a travel history. We've already been doing that. Other provinces, for instance, BC, not testing everyone who's even symptomatic, focusing more on healthcare workers and long-term care. So there is a variation across the country. It depends on what point in time you are in terms of the cases and the pandemic in our provinces. But certainly our goal is to test at this point anyone who has symptoms, mild symptoms, and looking for some of that community transmission in those cases, but also, for instance, in close contacts of cases who may not have symptoms.
Okay, thank you. And just a follow-up for Ms. Dowling. I think we talked previously about expected shipment of personal protective equipment and ventilators from the National Emergency Strategic Stockpile. Wonder if we've received those shipments yet.
Yeah, hi. We haven't received the shipment yet of the ventilators, although they may arrive today or tomorrow. But we did actually receive, over the last couple of days, and some again this morning, further supplies through the National Emergency Stockpile and from other vendors. So we have received some things, and we're just sorting through those actually today. To see what all is in there from the National Emergency Strategic Stockpile. We know we've received some of the N95 masks today, but I don't have the exact details on how many and which type, because there are several types of those. So we have received some of those supplies, as well as some supplies from other vendors. So we've received some supplies from vendors for gloves, as well as additional gowns, and the reusable gowns, of course, we have in use now at the Queen Elizabeth Hospital and Prince County Hospital, which helps with our other supply. So that's kind of where we're at with those supplies right now. I'm not aware that the ventilators were in our shipment that we received today, but we are expecting them any day.
Okay, thanks very much.
Rachel Collier, Eastern Graphic.
Hi. So lots of fishermen and their families are concerned about how they can apply physical distancing measures on boats or on the dock. And I'm just wondering if you might have anything to say about how lobster fishermen, women, and their families might be able to comply with physical distancing, and whether or not you think commercial fishing, lobster fishing, is or should be something deemed as essential.
So thank you. I actually heard from a number of families, fishers themselves and their families over the weekend by email, and same kinds of questions about and concerns about their ability or lack of ability to do physical distancing as they're getting ready for the season, when they're on the boat, and even as they come off the boat. So it is obviously it's a really a big concern. I have my brother-in-law is a lobster fisherman, and so I've also heard some of those concerns. It is a discussion that is at the Premier's level and also at a federal level because, as you mentioned, the commercial fisheries. I think it will be a discussion that is happening currently and over the next couple of days. To try to address some of those big decisions around the lobster fishing season, and we're at the same time we are getting looking at the guidance that has been produced and making it our own and wanting to make sure that we're happy with it around guidance for instance, processing plants. As we are getting questions about that as well.
Okay, thanks.
You're welcome.
I think that's everything. Thanks.
Great, thanks.
Carrie Wynn McLeod, Ocean 100.
Hi, Carrie Wynn.
Good afternoon, ladies. My first question would be for Ms. Dowling. Just in talking about the supply of the personal protective items that are needed, such as masks and gloves and gowns. Do you know if any local manufacturers or companies have been approached to help with that? Maybe they're able to retool and assist with the production of those things, much like the federal government has approached some other companies across the country.
Hi, Carrie Wynn. It's we have approached, and some local companies have approached us to help support our supply for some of these items. So there's a number of things being looked at. One would be the example of the hand sanitizer that we've received, which is one of the types of protective equipment that we use. Although it's not a piece of gear, it was something that is in short supply and difficult for us to receive from other normal vendors. So having a local producer of that has been a great assistance. There are some other groups across the province looking at even locally the reprocessing of our N95 masks and looking at how to sterilize those so we can reuse them. So there's someone locally looking at that. There's also a group locally looking at development of face shields and some of that protective equipment. So those are a few that I know of. And the province is also looking at these groups and looking at innovative ways and other opportunities that come where we can use local companies, but also Canadian companies and international companies as well to help with our supply.
Thank you.
You're welcome.
My next question is for Dr. Morrison. You talked about, on the weekend, a lot of people out gathering because the weather was so lovely and some not practicing social distancing. I'm just wondering if you were also aware of a huge event actually that happened in St. Felix, just outside of Tignish yesterday, where there were at least 20-plus vehicles there, about 50-plus people all watching snowmobiles and skidoos skipping across the ice in the river. Now, some were in their vehicles, but most were out in the sunshine, many, standing very closely watching this, and eventually the RCMP were called. and they responded only with one vehicle and one officer. They flashed the lights, rolled down the windows apparently to just talk to people, and prior to that, some people had already scattered to their vehicles. There were no names taken, no warnings were issued, and certainly no fines as well. Do you think the message needs to be a little clearer to the law enforcement across the province?
Well, I mean, we're having another call. I think it may have already started with our enforcement officers this afternoon in our office. So I'm sure this kind of situation may come up. I think they understand, our enforcement officers certainly understand the order under self-isolation. They understand the mass gathering order and the importance of physical distancing to protect themselves and everyone in our community. So I feel like we continue to give and send a very strong message, and we'll be certainly again on the phone today with our enforcement colleagues, trying to work together, and they are helping us deal with, for instance, the situation you described, which I literally only became I only found out about as I was walking into this room. But those are the kinds of things where most people are doing the right thing, and it will make a difference. And I go back to what I was saying in my earlier remarks, that if we want to do this right and we want to have a chance to ease up on some of these public health measures, we need to do this really well now. And so certainly our enforcement officers are helping us do that, and I'll continue to get that message out, and we'll continue to explore anything we can to protect Islanders.
Thank you.
Great, thank you.
Laurent Rigaud, La Voix.
Oui, bonjour, Dr Morrison. J'avais une question sur l'éloignement social. Plusieurs personnes nous rapportent que dans les supermarchés notamment, c'est parfois très dur de maintenir les distances de sécurité. Il n'y a souvent qu'une personne qui surveille dans les supermarchés que cela se passe bien. Est-ce que vous pensez qu'il y a d'autres étapes qui peuvent être ou d'autres choses qui peuvent être mises en place pour faire respecter la distance de sécurité entre les personnes?
Alors, je pense que ça va dépendre. Alors, pour les supermarchés, je pense qu'ils ont fait beaucoup de choses dans les dernières 2-3 semaines pour protéger les gens qui travaillent au supermarché, mais aussi d'essayer d'avoir les gens qui attendent pour au cash, avoir de l'espace, et puis ouvre chaque deuxième machine pour payer. Est-ce qu'il y a d'autres mesures? Je pense que peut-être on doit parler au council pour les retail council au supermarché pour qu'ils laissent seulement un nombre de personnes qui rentrent au supermarché. Et il y en a des places qui font ça déjà, alors c'est peut-être une possibilité ici. Mais on doit les parler parce que je pense qu'ils essaient de faire leur mieux. Il faut qu'on achète la nourriture, mais on veut faire ça dans une façon qui est sécure pour tout le monde.
Et juste un suivi, un follow-up par rapport à ce que vous avez dit en anglais tout à l'heure. Vous avez parlé des masques en disant que ce n'était pas forcément nécessaire d'en porter, parce qu'il y a beaucoup de gens aujourd'hui, pas seulement au Canada, mais dans le monde entier, qui se demandent pourquoi on ne nous demande pas de porter des masques. Est-ce que vous pouvez répéter ce que vous avez dit en anglais, en français, s'il vous plaît?
OK, je vais quand même essayer. On sait que les masques les masques protègent plutôt
les autres. Il ne te protège pas vous-même. Et puis, des fois, si vous portez un masque, vous avez un sens de sécurité qui n'est pas vrai. Parce que si vous touchez de votre masque, vous les enlèvez souvent. Chaque fois, vous pouvez avoir le virus là-dessus. Alors, il faut faire attention quand vous portez un masque. Mais on sait que si on essaie souvent de tousser dans le coin du bras et laver les mains souvent, peut-être un masque en public, si vous devez en porter pour un petit bout de temps, et vous êtes en train d'être sur un autobus, peut-être ça protège quelqu'un d'autre. Alors, on parle de ça maintenant. Je pense on commence à parler partout au pays à propos les masques pour la public. Les masques qu'on porte à l'hôpital, c'est un peu différent. C'est pour les médecins ou les infirmières d'être plus proches avec les personnes avec les symptômes respiratoires. So I'll just I'll just repeat in English just because the second question was about really what I said in English already about masks, and the first question was about grocery stores and concern that there may be too many people in the grocery stores and what else can we do about it. And I think that's a discussion with certainly grocery store chains and Retail Council of Canada. Are there things that we can do to limit how many people are in the store? They've already done a lot of things to help protect their staff and people who are coming into the grocery stores. We know we need to get food, and we want to do it in a way that protects the staff and the people there as much as possible.
Pierre Dufault, Radio Canada.
Bonjour.
Bonjour, Dr. Morrison. Les travailleurs essentiels, on le sait, ce sont les personnes qui sont autorisées à se déplacer, mais est-ce qu'il y a des obligations particulières pour ces personnes-là? Par exemple, est-ce qu'on leur demande de ne pas être la personne dans la maison qui fait l'épicerie? Est-ce qu'on leur demande de s'isoler, même de s'isoler de leur propre famille dans leur maison? Est-ce qu'il y a des règles particulières pour les travailleurs essentiels en cette période de pandémie?
Question. Pour les travailleurs essentiels et on a beaucoup qui travaillent un peu au Nouveau-Brunswick ou habitent Nouveau-Brunswick, Nouvelle-Écosse et retournent ici à l'île du Prince-Édouard. Pour ces travailleurs essentiels, il faut qu'ils s'auto-isolent ça pendant qu'ils ne sont pas au travail ici à l'île du Prince-Édouard. Et c'est vraiment à cause de la transmission communautaire qu'on voit dans les autres provinces aussi, et puis on veut minimiser le risque ici. Pour les autres travailleurs essentiels qui ne voyagent pas, on les demande, c'est pas les règles, mais on demande à tous les insulaires de rester chez vous autant que possible. On demande à tous les insulaires d'avoir juste une personne de la famille aller pour faire les courses. Alors, c'est vraiment les mêmes sortes de règles de suivre toutes les directions de santé publique, d'avoir la distance physique et laver les mains, les choses comme ça.
Merci, Docteur.
Merci.
Question in English for Ms. Dowling. How many beds do we have in ICU that are dedicated for COVID-19 here on P.E.I.?
Oh, that's a very good question. I don't know if I have the exact number with me here today, but we can certainly provide it for you because we have created additional ICU capacity, in particular within the Queen Elizabeth Hospital, and so preparations have been made to add spaces to that to create capacity beyond what our normal ICU bed count is within the province. So I can provide that to you afterward.
What's the normal count?
The normal count is, I think around 18. but I'm just not exactly sure. Sorry about that.
No problem. Thank you.
Oui, bonjour, Dr. Morrison. On a parlé la semaine dernière des contrôles à l'aéroport de Charlottetown. J'aimerais savoir comment se passent ces contrôles. Est-ce que ces contrôles sont réalisés uniquement pour les personnes qui arrivent à l'aéroport de Charlottetown ou il y a des contrôles aussi qui sont réalisés avant que tout voyageur prenne un avion à partir donc de l'île du Prince-Édouard? Et deuxièmement, j'aimerais savoir si vous avez été plus loin dans votre idée soumise la semaine dernière de demander des contrôles des passagers avant leur embarquement pour un avion vers l'île du Prince-Édouard.
Oui, OK. Peut-être je vais commencer par dire que quand les personnes arrivent au Canada à des vols internationaux, avec le Quarantine Act, tous les noms des personnes qui arrivent au Canada hors du pays, leurs noms sont maintenant ils sont envoyés. Alors, on a les noms des personnes qui arrivent hors du pays. Et puis, ils sont comme un screen quand ils arrivent. Et puis, s'ils arrivent à Charlottetown, ils sont demandés toutes les sortes de questions et on les suit pendant maintenant 14 jours. On les appelle s'ils ne sont pas là, on les appelle encore. Et deuxième fois, s'ils ne sont pas là, on les demande aux policiers, au renforcement de nous aider. On sont en train de parler c'est pas seulement à l'aéroport, mais aussi comme à WestJet Air Canada, et on va les parler pour que les gens savent s'ils achètent un billet, qu'est-ce qui arrive s'ils arrivent ici et s'ils doivent venir. Alors ces discussions sont en train de se faire et en même temps, on a beaucoup de questions pour tout le monde qui arrive ici.
Docteur Morrison, un follow-up par rapport à cette question. Pour avoir parlé avec les responsables de l'aéroport, il y a seulement 8 vols par semaine à l'aéroport de Charlottetown, au moins jusqu'à la fin du mois d'avril. Et ces vols sont quasiment vides, ou du moins il y a très peu de personnes maintenant dans ces avions. Quand on voit le faible nombre de personnes, le faible nombre d'avions, est-ce que ça ne serait pas juste plus simple pour vous de demander à l'aéroport de Charlottetown et Air Canada et WestJet bien de fermer ces portes, d'empêcher les avions de décoller et de venir à l'île du Prince-Édouard?
On a discuté ça avec notre équipe, mais on sait qu'est-ce qui arrive et que les gens vont arriver à Moncton, à Halifax, et puis ils vont quand même venir à l'île du Prince-Édouard par le pont. Alors, ça ne change pas le nombre de personnes, mais il y a aussi des cas où encore il y a des personnes qui doivent arriver assez vite. On a peut-être quelqu'un, leur famille est en train de peut-être mourir à l'hôpital et il veut venir tellement vite. Mais on y parle, certainement on parle. Et puis, vous mentionnez la chose, il y en a beaucoup moins de personnes qui arrivent par avion. Les vols, il n'y en a pas autant de vols, il n'y a pas autant de personnes.
Merci beaucoup.
Merci. I'll just translate that in English for those who may want to know. The question was about at the airport now, much fewer flights, many fewer flights coming in on a regular basis to Prince Edward Island. And when the flights do come, the number of people on them is much reduced. And so part of the question was if we're seeing such a reduction, should we just close the airport? And although we have had that discussion, we also know that if people aren't able to fly in here, they'll fly into Moncton and Halifax and drive across the bridge. So we're not limiting the people who are coming here. And there are occasions where it is really important that people have a chance to be able to fly in here and fly in here directly. Everyone who comes is screened, and as I mentioned, I think over the weekend, they are being followed then and for 14 days. So if they are called once and we don't get them, a few hours later they will be called again, and if we don't get them, enforcement will be called. And it is a way to make sure that people who are arriving from outside the province are self-isolating. And I think the earlier part of the question was, if people are arriving from outside the country, they are being screened at their point of entry into the country by Canadian Border Services Agency. And under the Quarantine Act, they not only are they being screened, but we are actually getting names of those individuals sent to us. And then, of course, we don't have the direct flights internationally into this airport, but we will also be screening them here locally when they come. So, anyway. Thank you very much.
Thank you.